A cancer diagnosis can raise many questions that go far beyond the purely medical. Many questions about meaning, about guilt, or even how do we cope when we don't know what's coming. For many people, the uncertainty about the course of the illness is often very difficult to bear, and that's when it helps to have someone there who can endure this uncertainty with us. Someone who simply takes the time to be there for us, who has an open ear and can empathize. When we're sad, but also when we're happy, and want to share that. These are precisely the tasks of a pastoral caregiver. Perhaps you've heard that your clinic offers something like this. And maybe you've wondered, pastoral care, what is that exactly? I can't really picture what that involves. What is it specifically? Well, you've just learned the most important part. A pastoral caregiver is someone who is there for other people and offers them support in particularly challenging life situations, and someone you can, for example, confide in about things you might not be able to or want to discuss with others. Questions of meaning, questions of faith, questions of guilt, how you're really feeling in your heart. So basically anything that, in the broadest sense, has to do with the soul. For example, why did I, as a young person, or why did my child get this disease? How could God or life allow this to happen? Did I do something wrong? In fact, pastoral care does have a religious background, as it originally comes from the church. A pastoral caregiver therefore always belongs to a specific faith. In most European clinics, these are Christian caregivers, a priest or a pastor. But many wards also have Islamic caregivers, such as an imam. And there's always the option to contact caregivers from a wide variety of denominations and religions. Often there's even a 24-hour on-call service, so that someone is truly available day and night. And by the way, even if you have no connection to religion at all, you can still make use of this help. The topics of God and faith can be part of the conversation, but they don't have to be, if that's not what you want. It's much more about pastoral care creating a special space for questions that have no easy answers or no answers at all. Basically, any event that confronts us with our own powerlessness, with death or with dying, is in a way a religious or let's say a spiritual experience. Perhaps you'll find that the pastoral caregiver is exactly the right person to discuss these things with. Many of them are also specially trained in so-called medical ethical questions. That means they can also support you when you have to make particularly difficult decisions, like, for instance, finding small rituals for yourselves that give you courage and hope. For some people, it also helps to use personal symbols or signs that they associate with something positive. For many, it can be helpful to pray or to put wishes and longings into words. And sometimes the words of the pastoral caregiver can also provide comfort. What can also provide comfort is a ritual during a transitional phase, a prayer and a blessing, for example, before surgery, before a stem cell transplant, at the end of intensive therapy, or even for saying goodbye when someone is dying. In these moments, pastoral caregivers can offer suggestions that you might not have thought of on your own. And here, it's perhaps important to emphasize again that a pastoral conversation doesn't just focus on the pain, the sadness, and the uncertainty, but also on the hope and the small and large moments of joy. Those also deserve to be shared and properly celebrated. So, and if you're now thinking, that sounds good, that could really help me, but how do I get in touch? The best way is to talk to your treatment team. They can make contact for you and arrange for a pastoral caregiver to visit you in the clinic. And if you're dealing with questions that have no clear answers, here's a quick note. We've also made a video on the topic of guilt and meaning, difficult questions that cancer poses to us. Feel free to check that out if you haven't seen it yet. You can find the link for it down below.